Well, everybody, the government shut down. What does this mean? Well, essentially, Congress failed to approve funding for the government. So most federal government agencies get pumped with money by bills that are passed by Congress and then signed by the president on October 1st. But as of right now, the clock is going to strike midnight and we are not going to have any funding approved to keep our government open. Now, essential government services like military operations and national security, social security, Medicaid, etc., all of that is going to continue, but discretionary spending will stop. And that's stuff that's not automatically funded, like education and transportation. So who is to blame here? Well, you've got the House and you've got the Senate. The House Republicans did their job and they passed a bill onto the Senate. Senate Republicans said, okay, great. Senate Democrats rejected it. Why? Well, two main reasons. Number one, they want to spend $1.5 trillion to reverse Medicaid cuts. And they want to give about $500 million back to federally funded TV news outlets like PBS and NPR. And the bill does not do that. Republicans are arguing we did not cut Medicaid for those who need it. We simply took 1.4 million illegal aliens off Medicaid. We took 4.8 million able-bodied Americans off Medicaid who were just choosing not to work, but who could. And they said we took off 1.2 million people who were no longer eligible for Medicaid. Republicans are saying we cut the fraud from Medicaid. We're not going to pile it back on. Now, Democrats are arguing that there was not a single ineligible person on Medicaid and everybody deserves it, so we need to reinstate it immediately. Democrats are also saying, well, Republican leaders, you weren't willing to meet with us to talk this through. Republicans are pushing back and saying, yeah, because that ends up just being a media moment where everybody gets viral social media clips for screaming at each other. And nothing gets done and it's not productive. Now, the bill that the Democrats just rejected was a very clean, small, continuing resolution that would have provided funding for the next 7 weeks. It would have got them through the government shutdown, then they could have had more negotiations. Democrats said no. But here's the funny kicker about all of this. Normally, when a government shutdown happens, federal employees are just temporarily suspended or furloughed, as they say. But this time around, Donald Trump is saying, oh, actually, a lot of those temporarily suspended employees, I'm just going to terminate them. He's calling it a reduction in force. Is this going to work? Probably not at all. He would have to give these government employees a 60-day notice before he could fire them. And I'm sure the government shutdown would not last that long. The last one we had was in 2018 and it lasted for about 30 days. Also, federal jobs have this really cute rule where you cannot fire people unless you have just cause. This is why our government is so gosh darn bloated. Donald Trump would face a lot of legal challenges if he tried to do this and just fire employees who are temporarily suspended because of this government shutdown. But honestly, it's not a bad idea if you're a conservative, you like a smaller government, a less bloated workforce, and less of your taxpayer dollars going to these bloated federal agencies. So there you have it, folks. The government is shut down. Democrats are actually going to take the fall on this one. Who knows how long it'll last? And we actually might start to see some firings of federal work people. Will this hold up in court? We shall see. Time will tell.
So, the US government has finally shut down. Guys, welcome to my YouTube channel. Thank you for stopping by. So, all credit goes to the creators in these videos. Guys, if you have been following my videos, my consequent videos a couple of days ago about how the US government is on the loom of shutting down. So, I'm sure you must know by now that the shutdown happens when Congress cannot agree on a budget or temporary funding plan. So, and the deadline was 30th of September and it has run out. So, without that legal permission to spend money, many parts of the government will stop working, right? It's not the same as the whole country closing down because the military still operates, social security checks still go out, and hospitals still treat patients. But the machine of government slows down and the whole area of public service suddenly goes dark. Guys, and the sad part of this is that this moment brings uncertainty because federal workers are not told when they would show up for work. They are told not to come. Many of them are being fired. And we all know that many people live from paycheck to paycheck. They depend on these paychecks to pay rent, to pay bills, and agencies that people count on like the IRS, NASA, they freeze most of their work. Just imagine this scenario. For example, you call for help for an important matter and you are being told, oh, sorry, we are being closed till further notice. That is what that shutdown means literally. And for many Americans, it creates stress, it creates confusion. Families will wonder where their next food benefit will come from, because they wonder if it's still going to arrive. And small businesses will worry about delays in loans and contracts. Even if you are scheduled to travel this season, you might face longer airport security lines, guys. The question we should ask ourselves is that, is this government still alive but limping? Or are they surviving on the barest minimum? Because this shutdown just shows that the government that people have chosen, right, to lead them can't even come to a conclusion and take a decision that is going to favor the populace, that is going to favor ordinary citizens that are stuck in the middle of this shutdown, guys. Let me know your thoughts in the comments, and I'll see you soon.
The U.S. government has officially shut down. Here is exactly what that means for you. As of midnight, Congress failed to pass a funding bill, and the federal government has now entered a shutdown. Now, essential services will continue. Social Security checks will still go out. Medicare and Medicaid remain in place. The military, Border Patrol, law enforcement, and air traffic controllers will keep working. But here's the catch. Most of those workers won't be paid until the shutdown ends. The bigger impact is on federal agencies. The Department of Health and Human Services is furloughing more than 40% of its staff. At the CDC, nearly 2/3 of workers are being sidelined. And at the National Institutes of Health, it's close to 75%. The FAA will furlough about 11,000 employees. Flights will keep running, but training and safety checks slow down. National parks may technically stay open by using visitor fees, but without staff or rangers, most will be inaccessible or unsafe. Now, here's what's unusual this time. The White House told agencies to prepare not just for furloughs, but for permanent layoffs and reductions in force. Even the Department of Housing and Urban Development put a banner on its website blaming the, quote, radical left for the shutdown, something experts are calling an unprecedented use of official government sites for political messaging. So why is this even happening? Well, the fight is over healthcare subsidies, Medicaid, and broader social spending. The House pushed a short-term funding extension, but the Senate rejected it, and neither side is backing down. Until Congress and the president reach an agreement, the shutdown will continue. Every day it lasts, hundreds of thousands of federal employees go without pay, scientific research is delayed, permits and projects are frozen, and the economy takes a bigger hit. For context, the last time that this happened, that the government shut down, was in December 2018. It lasted for 35 days, which was the longest in U.S. history. This is the first shutdown since then, and experts say it could be just as costly. The big question now isn't just how long will this last, but whether some programs and agencies could face permanent cuts once the dust.
I told you guys that it was going to shut down. It's officially shut down now. U.S. federal government shuts down after Senate fails to pass funding, mind you, the bare minimum. But yeah, so what does this mean? It just means a lot. Mostly it's going to affect the airport. The airport people who work at the airport, they're not going to get paid until this is over with. I remember in 2018 it was actually Donald Trump's first term, now that I remember, when it shut down for 35 days. I had a friend who worked at the airport who didn't get paid those 35 days, mind you. And they still showed up for work. Some people didn't. But, yeah. So, do we have to pay rent tomorrow or what? Because 2025 is just getting worse and worse.
Well, you still have to pay rent. Either you like it or not, you still have to pay rent. The effect of this shutdown just ripples out further than we expect, because those workers that are forced out of job without pay will be expected to pay their rent. I mean, there's no free accommodation for anybody, because these families live from paycheck to paycheck. So missing one or two, because we don't even know how long this shutdown is going to be, can mean falling behind on rent and so many payments, medical bills, and all of that. And I feel that the economy will also take a hit, because each day that the government stays closed, billions of dollars are lost in productivity. Business are waiting on contracts, or approvals are delayed. The stock markets will get shaky, because investors, you know what investors hate the most, right? They hate uncertainty. And the longer this thing lasts, the worse the impacts become, right? Guys, let me know your thoughts in the comment section, because all those people that voted for this administration, I'm not sure what they are remaining, or what is left, like, to break them finally. We all thought it was the Epstein's file, but now that this shutdown is happening, let's see if this will finally break them, because I really do not get it. Because if you cannot keep your lights on, I wonder the trust you have in the administration. Let's see what these other creators have to say.
The state's government has shut down, and I'm a doctor, so what does that mean for medical practice? Federal programs like the FDA, CDC, and NIH will be shut down. FDA is in charge of drug regulation. CDC is in charge of infectious disease and spread across the United States. So if there's, for example, an E. coli outbreak in an area, the CDC is in charge of investigating and issuing alerts and warnings about this and spreading awareness and taking action to resolve it. The NIH is the main federal government body that allows for research funding. And so related research projects like cancer research, especially at big academic centers, will be held. Medicare and Medicaid, the two government health insurance programs, will be delayed in their prior authorization approvals. Prior authorization is basically asking these insurance companies permission to get access to a medication, especially if it's expensive or more advanced, or being able to have surgery. Say your doctor says you need to have surgery because you have a cancer. You need the prior authorization for this to occur in some circumstances. And with the government shutdown, these prior authorizations will likely be delayed. Depends on how long the shutdown is. We don't really know, but I am worried about a backlog once the shutdown is resolved on all the prior authorizations submitted, kind of getting through that in a timely manner. Obviously, if your doctor recommends a medication and surgery, you want to have access to that as soon as possible, right? I already mentioned in a previous video, there will be strict regulations of Medicare with telemedicine coverage. Telemedicine is great for patients that have Medicare because Medicare patients are oftentimes elderly with mobility restrictions. There are also patients that live in very remote areas that are very far away from hospitals and doctors' offices. And Medicare also covers some disabled patients like those with end-stage renal disease. And so you can understand that these limited patients will have a hard time connecting with their doctor if they don't have access to telemedicine. Now, telemedicine is not entirely out of the question for Medicare patients. I mentioned in a previous video, it will still cover end-stage renal disease, psychiatric disorders, mental health counseling. There's an acute stroke rule out with the mobile stroke units, but outside of that, no. Your doctors and healthcare teams will always try their hardest to continue high quality continuity of care no matter what is happening in the world. But I do think it's a little important to stay up to date with the times and know what you have access to and know what you might need help.
Anyways, guys, here we are. The United States government has shut down. And it has not shut down not necessarily because the government or the nation is out of money, but because the leaders are out of agreement. Like, make it make sense. The workers have been sent home, the economy is stumbling, and citizens are left to carry the weight of whatever it is that is happening, guys. And people are online saying all sorts of things. Somebody was like, does it mean I don't pay rent tomorrow? Another person was like, does this mean that schools are closed? And all of that, guys. This shutdown is about people, right? Because I think we should just look away from the fact that it happened because of politics. Now, the ripple effect is gonna be about people. And the question is that, how long is this gonna go on? Because, guys, the effects are gonna be numerous. Anyways, let me know what you think in the comment section. I really want to hear from you. And if you have found value in this video, don't forget to like, share, and subscribe. And I'll see you in my next video. Please stay safe. Mental health is important. Ciao.